And the Ghana Health Service says it will conduct mass testing within the restricted areas in Greater Accra and Kumasi during the 2 weeks lockdown, which begins today. Now, speaking at the news conference at the ministry, we all do know that Dr. Keziamam, with the contact tracing team of the Ghana Health Service, said this had become necessary to help reduce community spread of the virus.
So currently what we do for contact tracing is to be able to identify the people and the places the case has been in contact with 4 days prior to symptoms showing, and following all these people for 14 days. If anybody starts developing any symptoms, we go test, and if it's positive, then that person becomes a case, and we also start contact tracing around the person. What we do is to tell the people who have been in contact with the case to self-quarantine themselves. And in terms of following the contact, we have two options. We have the self-check and the other check where the health workers come to your house and check every day to see whether you have symptoms like fever, cough, sore throat, any of the symptoms that we have identified as being expressed by cases of COVID-19. So we will continue doing these things in the areas that there will be restrictions, but in addition, there will be enhanced surveillance. So what we will do is that in the areas where we've identified as hotspots, in the houses where cases are, we will zone a certain area around the house, depending on the person's occupation, the kind of interactions they've had, the number of cases, and the lifestyle in the community, and then visit these households, one, to take information about the people, list them, so that subsequently if we need to do something, it's easier. Two, screen them in terms of the symptom diary, and then the last one would be to test them. We are doing this to be able to catch the cases early and treat, and also reduce the chances of the cases being spread to other people.